Hello everybody, this is Dr. Sokhandan or Dr. S again with you guys. I hope you had a great day, healthy and happy end of the day, and whoever watching my YouTube channel, listening to some of the health issue which is I discuss in my show, take the information and share with your doctor, and hopefully you get your optimum health with follow-up with your doctor and some of the discussion we have as far as our health go. Who are watching this program, please subscribe to my YouTube and ring the bell and also give the thumbs up. And any question you have, please go to my website, drsokhandan.com, DRSOKHANDAN.com. Over there we have lots of information. Also, the question which is you have, you can send it to me directly. I can look at it and I can answer it as we go. Today's discussion is come from a gentleman at age 43. He asked me, he have an issue with indigestion, acid reflux, having a sleep issue, and he have to sleep upright because when he's laid down flat, he get a little bit of acid reflux and is uncomfortable. Also, he's taking a Partalsac and now taking Pepsate. Again, I do not know anything as far as information, what his blood sugar is, what his blood pressure, cholesterol. Just based on what I have, I'm going to go ahead and talk about this and hopefully get some of the information out. That way he can listen and talk to his physician, see what he can do. And also, the people watching this video maybe have some issue, not at this extent, but some issue which is give them a little bit of a problem throughout the day, before meal, after the meal, and sometimes even constipation, diarrhea, which can be IBS, irritable bowel syndrome, can be leaky gut syndrome. We can talk about those in a mini other program, which is I will going to be doing in a future video. Also, if you guys subscribe to my YouTube channel, I'm going to start to do cooking show for you guys, to what type of food you guys can eat for your blood sugar, hypoglycemia, for your cholesterol. That way you can become healthy with your own environment and do not need to take the medication day in, day out. Of course, cooking is the simplest thing to do, but some of you guys maybe are not familiar with your own kitchen, then we can go ahead and help you to understand. You don't need to have a sophisticated kitchen and utensil to create a healthy meal. Whenever we're talking about the issue of indigestion, we have to pay attention how the food get digested through our system and what cause that symptom which is we experience. Let me just open up a little bit as far as our digestion system. Whenever you put the food on your mouth, through your mouth, some enzymes secrete by your saliva. Then from there is go to your stomach. The job of a stomach secrete a specific type of acid they call a hydrochloric acid. The environment of your stomach, the cell of your stomach, which is they call a parietal cell, can live in that acidic environment. Whenever that food gets digested, that hydrochloric acid has a many function besides digesting your food. One of the component of that digestion, with hydrochloric acid, the second one, shut down the sphincter between the stomach and your esophagus. After you've done your meal, you finish with your meal, that sphincter shut down tight. It means nothing can come up through this sphincter. When the food gets digested, it creates some gas, and those start bubbling. If you guys fix a stew, and when the stew gets completely cooked, you see those bubble and some steam out of that food come out. Our stomach has the same component. When that steam comes up and that sphincter is not shut down, that gas can escape upward. Since the cell of your esophagus is a different type of a cell, they call it a squamous cell, cannot stand in acidic environment. What happened that the steam of that gas, it hit those cells, it start to burn. That's what you feel, that burning of your esophagus. That by the time this happen over and over and over, then become chronic. And probably you guys heard people have a GERD between the inflammation of an esophageal, which eventually turn to cancer. The other component of that acid, it is turn on other secretion of that stomach, which is they call it gastric juice. Then from there it will go turn on to the bile from your gallbladder to emulsify your fat, if in case you have a fat in your food. If you eat protein, that will affect the pancreas to start secreting the enzyme like a peptase, protease, lipase, and many other enzymes to start to break down your protein. And also carbohydrate as amylase, which is start from the mind. Now, since we are a creature of a habit of eating food in a wrong time and a wrong place, it means we are constantly eating food on run. Maybe you are working, you don't have a time to sit down and enjoy your meal, and you forget your meal and you start skipping your meal. Then what's going to happen? You start to become hypoglycemia. This means your blood sugar is going to drop. But the first thing you get, as I talked before in other program about the hypoglycemia, when your blood sugar drop, your insulin is high. And you have some symptom with those hypoglycemia. It can be a headache, can be a shakiness, can be a cold sweat, can be lethargic. Then you will go after the food which is have high sugar to get rid of that symptom which you experience. Now those food, when it hit your stomach, the first thing it does, yes, it turns the acid, but will cause inflammation. It will cause lots of other issues. Now, whenever we're looking for our digestion system to try to absorb the food, and the food you eat have a lots of nutrients, like hydrochloric acid, when it's low, it means your system becomes hypochlorhydria. After a while, those pyramidal cells become lazy. They do not work as sufficient because of the type of food you guys been eating day in, day out. Drinking a caffeine, drinking a pop and soda. The soda has a phosphorus. and it's got a caffeine attached to it, those will block those cells to secrete sufficient hydrochloric acid. Then you get those issues of indigestion, you're getting a heartburn, you're getting constipation, you're getting the undigested food you see in your stool. Then the food you're eating, since you don't have enough acid in your stomach, you go to your doctor says, well, since you have a high acidity in your stomach, we have to give you something they call an anti-acid. Unfortunately, that is the wrong information. You are a low acidity, not high acidity. When you take in those Pepsi or Pyrlosac, even the drug, which is we have a Zantac and Nexima, which is recently, if you guys been listening to the news, FDA had a recall on those medication, which is cause cancer. On top of that, those anti-acid will cause osteoporosis. It means you're losing your bone. Even when you're drinking those pop and soda, those phosphorus and those soda will deplete and bleach out your bones from your system. Then we need to pay attention what we put in our mouth. The low acidity of your stomach, it will not allow your B12, your folic acid, your calcium be digested. For a good bone and a healthy body, the calcium needs to be digested. It needs to be a good amount of the hydrochloric acid in the stomach, and also be sufficient to make sure that breakdown happen and well absorption happen. And also you need an extra magnesium to take that extra calcium out of the system. That's a different subject we will talk about later. The other part of a good amount of a hydrochloric acid in your system, if you are a hypochlorhydria, it means low acidity of your stomach, increase the risk of intestinal parasite, increase the SIBO, H. pylori or Helicobacter. The people which is getting some food and they get sick, from E. coli, Salmonella, Shigella, those can come from low acidity of the stomach. They call it hypochlorhydria. In some families, sometimes they eat the same vegetable or they eat some food. Some of them get sick, some of them don't. If the people have a low acidity of their stomach, they get sick, and the people have a high acidity in the same family, nothing to happen, because those parasite or those infection or viruses get killed in the stomach by acid of the stomach before passing through the duodenum and move on to the small intestine. It shows people with the low acidity of the stomach, they have alopecia. It's been their hair loss, and they get some area of their hair get completely lost. And also it shows risk of a gallstone. It shows that people with low acidity, they have a high risk of an allergy. I hope John listened to the question he asked, and some of you which have that issue, hopefully you pay attention. You can go to your doctor, ask for the blood work, and when I work with my patient, I do a complete blood work. I ask them to do those blood work from all the enzymes secrete from pancreas, from lipase, protease, peptase. Also check the insulin, check the amount of the acid, with the doctor, which is they drop, you eat it, and they measure by the computer how much your stomach secrete acid. Those blood work can tell what is issue with you. Just pay attention. Just the blood work when you guys do, it should not just be a cholesterol and just the blood sugar and some simple for thyroid. Complete blood work is important to tell your doctor it's what the issue with the system is. And sometimes your doctor will not going to have the time to spend as much of the time with you. Find a doctor who can go to the detail the nitty-gritty of those blood work and find what's the issue. Because your health is the number one wealth you have. If you do not pay attention at the age, which is 30, 40, 50, you become my age 65, then you will not gonna be take care of when you come that age when all the disease processes start to set to the system, and you start taking a medication, one medication to two, to the three, and suddenly it looks like you are you become your own pharmacy, and taking every drug is available to just get rid of your symptom. The drug prescribed properly and right, it's good, is wonderful, it helps the cause. When the prescription drug prescribed wrongly and will cause lots of damage and will make you sicker, not healthier. I hope you guys enjoyed this video. If you like to hear more about the health issue, you can go to my website, Dr.Sokhandan.com, write any issue you want me to talk about, or any issue you have, and also subscribe in my YouTube video. And I will gonna start do cooking on YouTube and show you how cooking be done for the type of the health you're seeking. Can be a weight loss, can be for your blood sugar, can be for your blood pressure, and so on. Wish you have a great day, and hopefully see you soon.